Hello, my name is Joshua Sanchez. I am the benefits analyst with London Brown Group, and today I am going to be giving you a webinar on how to access myuhc.com. So what is myuhc.com? This website is a user access portal for individuals who have elected medical benefits with our company. So the first thing that you need to know is how to access the website. To get to this website, you will go to your browser up here and type in www.myuhc.com as shown right here. At that point, for most of you, you will be registering as a new user to this site unless you've already registered. So the first thing that we're going to discuss is how to register. Right here, you'll click Register Now. And then the first page will require you to fill out some personal information to set up your login. First thing you'll do is fill out your first and last name along with your date of birth, and then it's going to ask you for two pieces of information concerning your actual user information with UHC. That is your member ID number and the group number. These can be found on your member ID card that you were mailed, and if you have not been mailed or received your member ID, please contact me and I can get you this information as well. So where is your member ID number and group number? As shown here, although it's blacked out, your member ID is listed here in the upper left-hand corner with the group number listed in the upper right-hand corner. So that's the information that you're going to put in right here. Member ID number, group number, and then you're going to click next step. Now you're going to create a username and password. Definitely read through the guidelines here for what's required of the username, and the same thing with the password, so that once you've completed both of these steps, it doesn't error out and require you to change the information so that it properly matches. Now you can also use your email address for the username, so that might be a better option just because it'll be easier to remember and less likely that two people have that username. Click next step, and then this is where you're going to create your secure login information. So you'll enter your primary email address. You're going to confirm that email address, and then you have the option to put in an alternate email address, which isn't required, and then it's going to ask you for your home phone number, work, and mobile. Again, all of these are optional. What is not optional is the security questions. From here, you'll have a drop-down box that allows you to select from multiple options, so just pick the options that you feel would be easiest for you to remember, but still secure, and then answer them with whatever your answers are. The next thing it'll ask is this a recognized device or not? And what this means is that if you're accessing this site from, say, your personal computer or your phone, you can definitely click yes, this is a private device, and what that'll mean is that it won't always ask you the security questions. But if you're using, say, the computer in the store to access the site, I would definitely recommend selecting no, just so you have that added layer of security. The final two things are I wish to receive marketing and promotional information. It's completely optional whether you elect this or to check this one or not, but you do need to check that I have reviewed and understood the website policies. You'll click submit, and then this is basically a confirmation page stating that your registration is complete. From here, you can access your account, and this is what my UHC will actually look like once you've logged in. Now, just some notices. We will only have medical insurance through my UHC. The dental information, we have a different provider for dental if you are eligible for it, so this information will not be here. The only thing that you'll see is this. Now, just looking at the top, you have a home, claims and accounts, physicians and facilities, pharmacies and prescription, benefit and coverage, personal health record, and health and wellness. The personal health record and health and wellness are something we will get into in a later webinar. But the first thing I want to get into is how to find a network doctor. So if you click on this Find a Doctor, what this will bring you to is something that states virtual visits, search for network providers, and search for dentists. Again, this information will not be here, and it's very probable that right now this virtual visits will not be here either. So you're going to click on Find a Provider, and then if you're trying to find a primary care physician, you're going to go here and you're going to click People. And then you see that it comes up with a bunch of different options, specialty care, primary care, and virtual visits. Select on the primary care. Once again, click primary care. And then what you can do is become a little bit more detailed, such as listing the zip code. So list whatever zip code you're in, and then you can identify how far out you want to extend your search for individuals who are in network. And then you also have the option to select by gender, language of the physician, new patient status, specialty if they do have any, such as family practice or pediatrics or even knee surgeon. And then hospital affiliation. So if they're affiliated with a hospital in the area, they'll list it here. So what this is showing you is all the primary care physicians in your area who are in-network providers for UHC. And the reason that this is important is that there is a difference in the overall cost to you, the employee, if you're using an in-network provider versus an out-of-network provider. So there's definitely an advantage to finding in-network providers before you go to the doctor. Now, what we're going to do is we're actually going to go back and click back again, click back again. So let's say you already have a primary care physician and you want to see if they are part of the in-network provider group for UHC to verify whether or not the doctor that you're using already is in-network. Because if they aren't, well, maybe you want to stay with them just because you feel comfortable, but maybe at the same time you want to switch to a different provider so that you're getting the best advantage. You would simply type in the individual's name here. So, Joe Smith, and then click search. And apparently it didn't like my name, so it came up with flu vaccines instead. But that's a tool you can use to search for individuals. Or let's say you're looking for, clinicals, a hospital in your area, and you want to make sure that it's in network. You would just search by place. Same thing with testing and imaging, or services such as office visits, tests. All right, so that's how you would find network providers. And again, that's a great tool to be using to make sure that you're getting the best benefits from the insurance. The next thing that we're going to look at is claims and accounts. So what this shows you is how much of your deductible you've used, how much of your out-of-pocket maximum you've used, things like that. So as you can see, this individual has themselves, their spouse, and then it looks like a child on theirs. And it's showing that the individual themselves has used $90 of their $1,000 deductible, and that they've used $90 of their total out-of-pocket maximum. And then you can see the same thing for the spouse and the child. And then you can look down here and see the overall family portion of the deductible used. Same thing with the out-of-pocket maximum. So the next thing that you can do on this page is look at the claims summary. So anytime that you've been to a doctor, they will issue a claim, and and the insurance will pay a portion of it, and then you may get a bill as well. So this is showing you who's gone to the doctor or some service. So the spouse has gone to visit John Q. Public, which is probably a primary care physician. It'll list the date that it occurred, the amount billed, and it'll list how much the individual member you are responsible for. And then you can also select claim payments, but in all likelihood, these will actually be mailed to you so that you get an actual bill in the mail that you would contact the insurance company about paying, or contact the provider about paying your portion. So there's also some other information here, but these aren't services that are provided. So the key ones that you want to understand is the account balance and the claim summary. And then we're going to go back to the home page, and let's say that you've lost your ID card, and so you need a new ID card because you don't know the information off your head. So if you're going to the doctor, you want to make sure you have your ID card. You can actually come over here and go print ID card, and you can either decide to print one, which will just be a paper document similar to this. So if I expand this out, it'll be something similar to this for your paper ID card, or you can have them mailed out to you, which would mean you would get the actual ID card in the mail. One thing that you want to make sure of is that your address is up to date, because if not, mailing out the new ID card it's in all likelihood going to be sent back. So let's say you wanted to change your address. If you click change your address, it'll tell you right here that you need to contact your benefits administrator about doing this. So if you need to change your address, what you would want to do is contact me directly, and I will let you know how we can go about changing your address. So let's go back to the home page one last time. And you can also come in here and manage your prescriptions. So home delivery, we're going to click no thanks for now. Close out of that. And this will show any prescriptions that you have, and it'll show you how many times you have to refill them and when those prescriptions expire. And you should also be able to come in here and price out the drug. So let's say you were given a prescription of Vicodin. You could type that in here and see if it comes up with other options that are a cheaper option, like Tylenol 3 instead. And then there's one other thing that you can cover. If you go into plan details, all of these options are documents that will let you know some information about the plan, an overview of the plan. So if you select preventative care, 100% of eligible expenses not subject to deductible. What this means is that if you are doing a preventative care visit, the entire cost is covered by the deductible. And so click back. You can go into each one of these and it'll give you a detailed understanding of the information. So this has been an overview of the generalized use of myuhc.com and the benefits. And I'd just like to summarize. This is a great way to keep track of what portion of your deductible you've used, as well as what portion of your out-of-pocket maximum you've used. It's a great way to find in-network providers so that you can get the best overall coverage level from from UHC. And it's also a way for you to access some information about the overall plan, and then obtain replacement ID cards if you have lost them. This has been our overview of myuhc.com, and I hope it's been extremely helpful. And if you have any questions, feel free to contact me directly. Thank you.